Hello, my name is Adam. This is my BSN 346 deep tendon reflex video. So today what I'm going to be doing is performing a deep tendon reflex on this patient. I would first go into the room, close the door, provide myself with some hand hygiene, and then make sure that I have correctly identified the right patient by having them state their name and date of birth, which they have correctly done so. I would also then start to explain why I'm here. And the reason I'm here is that I'm going to be performing a deep tendon reflex test on you today, and that's going to help by testing the functionality of your motor neurons, and that's also going to be subjectively graded by me on a scale of 4 being hyperactive, 3 hyperreflexive or reflexive, 2 being normal, 1 being diminished reflexes, and then 0 being absent in those reflexes altogether. Also, when we get down to the ankles, we would be performing a clonus test or a clonus reflex test, and that's going to be helpful to watch out for, or like a warning sign for people that potentially might be preeclamptic during pregnancy, because those patients typically have a bit more hyperreflexivity in those deep tendons. So we'll get started, and obviously if she had any questions, we would answer those along the way. We'll start with her brachial tendon, and so I would palpate the brachial tendon, which would be located right here with my thumb. And then to test the reflex, I'm going to strike with the pointy end of my mallet on my thumb right here. And you kind of see her hand kind of twitching upwards, so that's great right there. That's a normal reflex. We're then going to go into the tricep, which same thing, I'm going to kind of try to find her tricep tendon, and then cool, and you see it kind of moving up like that, which also once again normal. And now we're going to go down a little bit into the patellar tendon and then in the Achilles heel. So same thing, kind of just keeping her leg relaxed. I'm going to really find her tendon where patella meets the tibia fibula right there, and cool. So see just that slight movement, and then the last one in terms of reflexes, we'll do her Achilles heel. And so I'm going to actually kind of just nice and relaxed. Just relax your leg. And I'm going to dorsiflex upward, and then I'm going to strike down here. And you're going to see, whoa.
I have.
And I want to do that one more time. All right, first one is a little bit more hyperreactive, but the rest aren't as much, but you see it kind of pointing upwards. And then the last one we would do is a clonus test, which all I'm going to do is I'm going to dorsiflex the leg upward, and then all you would expect in a negative one would see it drop down, just like a regular reflex would. So just drop like that. If it was positive, you would see it would be a little bit more bounding, and you would also be able to take it, and you could see it bouncing in your arm. You would see about 3 bounces in that regard. I would also then want to get my patient into a comfortable position, make sure that they're okay and everything, and then perform hand hygiene to then document my findings. And that would be that. Thank you very much.